Question, the member from Simcoe-Grey.
Thank you, Speaker. My question is for the Premier. Premier, for the past 3 months, I've been campaigning against closures of medical laboratories in Stayner and Elmvale. In this province, there are 3 companies who have a monopoly on diagnostic testing. One of those is LifeLabs, and like the others, they rely on taxpayers to stay in business. In fact, we're their only customers. April Gamache, LifeLabs Vice President of Operations, gave a speech in Atlanta last year on how to find, quote, substantial cost savings at a conference where the first 3 words of the flyer reads, "Cash is king." Premier, why is your government supporting companies that put cash before patients?
Patients first. The Minister of Health.
Speaker, the member opposite has raised what I think is a very important issue, and that is the adequacy of the health labs in this province to meet the needs of the people. You know, Speaker, we are committed to reducing the incidence of diabetes, or at least stopping the increase in diabetes. Part of that means that people have to access lab services more frequently. We are working, Speaker, to resolve the issue of access to lab services. It is something that is very much an issue we are working on. I think it's important to note, Speaker, that that access to labs is part of our healthcare system. They are private companies that deliver this care. But, Speaker, I think that we do have some responsibility to make sure people have access.
Supplementary.
Well, Minister, on Friday, my office spoke with Minette Greenway, LifeLabs Vice President for Government Relations. On the phone, Ms. Greenway confirmed that LifeLabs has no intention of permanently reopening the Stayner laboratory that your government allowed them to close. When we asked about seniors on fixed incomes who now have to pay $80 to go from Creemore to Wasaga Beach and back just to get their blood checked, Ms. Greenway said LifeLabs can't worry about every patient. Minister, it's about time that your government started dealing with lab companies who understand rural Ontario and care about our constituents. Since LifeLabs is unwilling to commit to keep their Stayner location open on a permanent basis, will you show some leadership and revoke their license?
Minister of Economic Development, final warning. Please continue.
Minister, will you show some leadership and revoke their license, take the money you were spending in Stayner, and give it to another lab company who will do the job right?
Minister.
Speaker, as I said in the first answer, this is an issue that is very concerning, and it is under active consideration in my ministry right now. But, Speaker, I mean, really? This is the party that really did an excellent job destroying our healthcare system, Speaker. When we took office, Speaker, you couldn't find a family doctor who was taking new patients. Speaker, when we took office, hospital funding was, we had very serious problems around wait lists. Speaker, people were waiting 2 years and longer for access to procedures as simple as cataract surgery or hip replacement surgery. Speaker, we have worked very hard to repair the foundation of our healthcare system. If they have a plan, Speaker, to improve healthcare by cutting $3 billion out of it, I want to see that plan. So you can't stand on that side of the House and complain about it.
New question, Leader of the Third Party.